Assalamualaikum, salam sejahtera. Saya Suhaimi Sulaiman. Malam ini seperti biasa kita akan ada segmen diskusi pra-bajet kita kerana bajet 2012 akan dibentangkan bulan depan Oktober, dan fokus kita pada malam ini ialah tentang pengangkutan Itu kita akan bincang sebentar lagi. Tapi topik kita pertama ialah ini sempena dengan pelancaran laporan UNICEF tentang remaja dunia, termasuk juga laporan tentang remaja Malaysia. Malam ini kita nak berbincang tentang remaja dan pendidikan kesihatan reproduktif Kita ada 3 tetamu khas kita di studio. Saya perkenalkan mereka. Di sebelah kanan saya ialah saudari Eng Hui Chin. Beliau adalah ketua projek First Aid Kit. Nanti kita tanya dia apa sebenarnya projek yang dibuat. Dan bersama kita juga ialah saudara Azrul Muhammad Khalid. Beliau adalah jurucakap dari Perubahan Bangsa Bersatu UN dan juga UNICEF. Selamat datang saudara Azrul. Dan bersama kita juga ialah saudara Firdaus Jasdin. Beliau adalah sukarelawan FRHAM, iaitu Federation of Reproductive Health Associations Malaysia. Nanti kita tanya apa sebenarnya yang dibuat di situ. Okay. Saya nak mula dengan saudara Azrul dulu. Dan kalau kita cakap tentang pendidikan kesihatan reproduktif bagaimana kita tengok ataupun mengukur tahap ilmu dan juga pemahaman remaja berumur antara 10 hingga 19 tahun di Malaysia, apa yang mereka faham, apa yang tak faham, dan apa yang dimahukan, akses dan sebagainya. Kita mula dengan tahap pengertian pemahaman mereka tentang ini.
Kalau kita tengok dari segi kurikulum, apa yang kita ada within the Malaysian education system, we have what's needed. What is actually missing here is actually the translation from theory to actual implementation behavior. And when we look at young people in Malaysia, we are very concerned, because I'm sure you've seen the reports of abandonment of babies, teenage pregnancies, rise in sexually transmitted infections and HIV/AIDS. A large majority are coming from the category of persons that we call young people. And for the purposes of UNICEF this time around, we're talking about adolescents, we're talking about those between 10 to 19. And all of these are symptoms of something bigger, and that is a dearth of information translating to behavior. And I think for Malaysian young people, I think there's something problematic there. I think that we have a problem, because it seems that whatever we're teaching in school, whatever we're trying to impart to our young people, it's not translating to behavior, and it's translating to these problems of teenage pregnancies. And when we look at it, I don't think that young people are getting enough information to protect themselves. And when we look at sex education in schools, maybe it's still not enough to enable them to make informed and responsible decisions that link back to issues of sex.
Yes, but how do we empower them? Because yes, you don't learn all that in schools, but they all have access to the internet, and most of the time they are online, and you have lots and lots of I would say materials if you really want to know about it. But how do you get them to find the materials and guide them? Maybe something is not there to actually guide them and empower them.
Actually, it's good that you mentioned that. The fact that young people are resorting to the internet actually shows not only a desperation to get more information, it shows that they cannot rely on the education system to get the information that they need. They cannot refer back to their teachers to answer the questions that they need answering. So they're forced to refer to the internet, to their friends. But the internet is a very risky, dangerous and volatile environment where you get right information, but you also get the wrong information. And when it comes to guidance, honestly speaking, at least from what we look here in Malaysia, there are very few people who are guiding young people to reach to the right answers to the questions that they're asking.
That is why you have peers. I guess, Saudari Eng, that's why you started this when you were in school. Yes. Just tell me what actually.
All right. Actually, First Aid Kit is the project I started back then in 2010. When I was 16, I attended this conference, and we were asked to design this community project that is going to be implemented in our own country. So, well, from this project, we have done it peer-to-peer education. So what we do is we teach other young people, from young people, to get them involved. Let's say teach them what HIV is about, how do you contract, how do you get let's say STIs and how HIV is transmitted. And all of this is actually very important. And to add on what Azrul said just now, well, actually I know that in biology and moral education, there's this page, or I mean this chapter that's dedicated to teaching youth about what is sexuality education about. But then the problem is it's not enough. It's just a page, it's just a chapter, and then there are not enough interactive discussions between the teacher and the students. And the problem is
why is that? Because people don't talk about it, or what?
I think it is that sometimes adults are don't know how to approach the subject with their children or the teachers to their students. So I think that, well, we go to school every day, and then schools are the best way to reach out to young people and give them the correct information.
When you say young people, who do you talk to? Because sometimes, we move in groups that, you look a very nice, decent girl, and of course your friends will also be nice, really decent girls, and maybe they don't need that help, and it would be a different group of people who would need that help. Now, how do you bridge that so that you can cover there's a mass appeal, or is that right, or what's the strategy here?
You mean how does it appeal to different groups of people?
Correct. So how did you do it?
So it's like we have a club, we have a society, and then you have different people inside it, and then you, of course, you recruit your friends and everything, and then you get these people who are the core group of the society to go out and promote.
I see. Okey, kita tanya pula Saudara Firdaus. Saudara Firdaus pun dah lama juga berkecimpung dengan apa sebenarnya Saudara Firdaus buat dia?
Okey, macam ni. Saya dari organisasi FRAM, Federation Reproductive Health Association Malaysia. Okey, sebelum ni kita dikenali sebagai FFPAM, Federation of Family Planning Association Malaysia. So bila orang dengar family planning,
dan Firdaus kelihatan sangat muda dan bercerita tentang family planning. It doesn't jive at all,
jauh lah. Tak ada. Okay, so bila orang dengar family planning, ini untuk orang kahwin je kan. So actually sebab tu kita switch ke reproductive health. Reproductive health ni is a wide range. Wide range, covered all. HIV AIDS, family planning, STIs, the cancers yang related dengan kita punya reproductive. Okay, so actually kita punya organisation terbagi pada 3. Kesihatan lelaki, kesihatan wanita, dan for young people. So saya mewakili young people. Kita orang ada satu modul khas yang kita orang panggil RIME module, Reproductive Health for Adolescent module. So modul ni mengajar young people tentang kesihatan reproduktif. So kita ajar tubuh badan lelaki dan wanita, HIV AIDS, STI, STD, all the cancers.
Firdaus ajar siapa? Firdaus ajar siapa? Ada umur, lingkungan umur berapa?
Kita punya target 15 to 24 years old. Okay, so macam last year kita ada satu project, Salim Plus project. So our target is for marginalised people. Marginalised yang people, budak-budak yang drop out of school, yang vulnerable, yang susah kita nak reach. So kita approach diorang. Apa
yang membuatkan diorang ni, mereka ni nak dengar Firdaus? Nanti dari kata Firdaus ni poyo lah, kan lah, nak bagi macam bagus je lah kan. Jadi bagaimana untuk sampaikan message itu ya?
Okey, macam mana untuk sampaikan?
Apa yang membuatkan mereka tertarik untuk dengar, selain pada Firdaus muda, apa yang membuatkan mereka nak dengar, orang ni mungkin kita boleh kawan kot.
Okey, bila kita bercakap tentang sex education, berkaitan dengan kesihatan reproduktif. So bila bayi-bayi kita macam ni dengar sex education, wow, interesting, macam best je kan. So daripada situ kita attract dorang, apa yang awak tahu. So then sometimes bila dia tahu saya buat volunteer dalam sex education, budak-budak ni suka datang tanya. Dalam bentuk apa? Dalam kelas ke? Dalam di kedai kopi ke? Di tepi pantai ke? Macam mana? Okey, macam ni. Untuk last time punya projek, kita pergi ke organisasi. Kita bagi tahu diorang, okey, kita ada satu projek. So projek ni, ini objektif dia. So then kita nak some of young people, minimum around 15 orang. So untuk duduk, sit and join our activity. So daripada situ kita terus ice breaking, and then kita bagi tahu diorang apa kita buat, just go. Then mula-mula memang ada yang macam boring, macam alah betul ke ni, nak dengar ke. Then bila dia dah follow kita punya modul, kita punya aktiviti, then the best part is educator tu kena friendly lah.
Ya, betul.
Bila diorang dah friendly, diorang dah get along, dah senang, nanti bila hujung-hujung kan, semua keluar. Bang, ada masalah. Bang, macam mana ni? Bang, macam mana tu?
Oh, because they don't have access
Yes.
to people that they can talk to, and yeah, because when I was very small pula, when I was relatively young, I'm 50, okay, when I was young, I it's like almost a taboo. You do not talk about this with your parents or your siblings, and you only talk to the people of your age, and they are as ignorant as so how do you do this, and how should we change all that? And later on I would also want your experience. How do you measure the success of what you do? How do you know that this is effective, people are actually listening to us, and how do you know that I've changed a little bit here, because everyone would play a role in this one. So we'll discuss right after this short break. We'll be back after these messages. Baiklah, seterusnya soalan untuk saudara Azrul. Bagaimana kita tahu apa yang kita buat ni? Saya tengok apa yang saudara Firdaus buat, Cik Eng buat, semuanya saya rasa mereka ni ada passion, suka apa yang mereka buat. Bagaimana kita tahu apa yang dibuat ini berjaya, bagaimana kita mengukur kejayaan itu, dan bagaimana kita nak buat dia lestari, sustainable.
Actually, it's not that hard to see whether or not what we're doing is actually effective or not. We measure using surveys, we use indicators and whatnot, but basically when we look at the incidents of sexual violence, for example, exploitation of children, of basically child marriage, teenage pregnancy, abandonment of babies, all of these can be used to measure whether or not what we are communicating, what we are sending out messages to through our educators to young people is effective or not. Because many of these cases are involving young people, not necessarily as perpetrators, but as victims. So they're the targets of many of these acts in which they actually have to somehow discover a way to go through it. You mentioned earlier just now about how when you were younger, you
definitely my father will not talk about sex with me.
Yeah, but you've had to find it out for yourself. About the facts of life, about sex and sexuality and whatnot. Believe it or not, today, 50 years later, it's still the same thing. People are still groping the dark.
Yes. Why is that so? Because people, you see debates, you see in the media, people say that, hey, we have to change our attitude, we have to, but it's not changing. What's wrong?
You know why? We forget that even we can create the best curriculum, and it's all there. So I mentioned earlier on, you have it there, but we forget the human element towards this, and that we forget that the educators, the teachers themselves are human. They themselves are parents. They themselves are bound to the same cultural and religious norms that they have been brought up with, and to expect them to overcome that in order to deliver, the information that young people need is a huge undertaking.
So this is where I think, do you face resistance, or for example, when you start talking to people of your own age and people with a different cultural or religious background will say, why is that girl talking about sex with my son or daughter? Do you face that, and do you also face the same thing like what Firdaus said earlier, that after the talk, after the sessions, people actually come to you and ask questions and say lots of things that would actually surprise you with the level of ignorance about reproductive?
Well, actually, we have done talks and everything, but then the problem is because our project has been started small scale, and that we have been through many trials and errors. But then I think that resistance is definitely is there, and especially when we want to start the conversation. Let's say I want to start this project in school, but then it's how you want to. Sometimes we worry. How did you start?
Today, boys and girls, I'm going to talk about sex today. Are you crazy? How did you do it? Yes.
Actually, we got approval from school.
Okay.
So, and then well, I'm very thankful that the school is very supportive, and actually I believe that other schools should follow suit as well. Yeah, because it's I wouldn't say the resistance level is very high in my school, but then I'm sure Firdaus has faced a lot of resistance in other schools.
Kenapa resistant? Kenapa orang rasa apa ni? Apa ni gila ke budak ni kan?
Okay, macam saya punya experience lah. Ada, memang selalu berlaku. Setiap kali saya buat, mesti ada seorang budak, dia akan buat muka sampai tengah-tengah. Then my manager akan tanya, siapa yang dia akan tanya, okay, ada tak sesiapa yang rasa tak selesa? Kalau tak selesa apa, boleh angkat tangan. So then ada one boy tu, dia angkat tangan. So dia kata dia tak selesa, dia nak keluar. So memang tak selesa dengan benda ni semua. Okay, so then we respect. So then it's okay. So then we just continue. Then after that, we just go through him dan tanya, kenapa? Ada masalah ke? Dia kata tak, saya tak tahu, saya tak suka benda-benda ni. Lagipun kalau ayah saya atau mak saya dapat tahu, habis saya kena. So macam Cik Azul cakap, budaya dengan agama memang tak boleh dipisahkan.
Itu betul. Tapi kita kena sampaikan informasi tu. The education part is very important. So how do you change that so that the message will, at the end of the day, reach the people who really need that? Because if you're not equipped with this knowledge, because you testosterone raging and all that, and how do you manage this? How you are responsible? So how do you get this? Given like what Firdaus just said, that if my parents were to know this, I'll be killed. But how do you change? But appreciating that, yes, we understand you cannot change this overnight, but to get the message across, because like you mentioned, syllabus like that human factor and all that.
Well, first and foremost, we need to be pragmatic and realistic, and to basically accept the reality of the situation. Young people need help, especially when dealing with these life issues and dealing with sex and sexuality. And our hope, interestingly enough, isn't necessarily the education system. It's actually on these guys. They will need to actually come forward to be part of solving that problem, to ensure that the best delivery mechanism is brought forth, to ensure that they get the information. I think having 60-year-old people, 50-year-old at the policy level, making these decisions for young people, designing the programs, when they are out of touch. It's not that they don't know what they're doing. It's just that, I think to make it more relevant for young people, we need to get
people.
Input. And I think we've left them out of planning, of the implementation of these programs, and even the evaluation. So we don't even know whether what we're doing is actually right or wrong.
How do you know that you are imparting the right information and package it the right way? How do you know that you're doing a good job? But of course you're doing a good job because now you got funding and all that, because it makes what you're doing very sustainable, which is good. Congratulations.
Thank you. But then what I want to say is actually, of course, what we're doing is peer-to-peer. It's use for use. But then we still need the guidance of adults. So that's why parents and the support from parents and teachers and the elders are very important. Like for us, our project was guided by a representative in Malaysian AIDS Council. So through them, we know, okay, what we've done, what are we doing the right thing, and they will be there to guide us when if let's say things go wrong. So definitely, adult supervision is still very important. But then young people should be still included in the decision-making process.
I think that's very important. Dan akhir sekali saya nak tanya Firdaus, apa yang membuatkan Firdaus ada, kalau saya gunakan kata passion untuk buat benda ni, apa sebenarnya latar belakang yang membuatkan saudara Firdaus mahu buat benda-benda ni semua?
Okay, first kali sebenarnya saya ada banyak masa kosong.
Okay.
So saya bekerja masa tu. So then boring lah. Hari-hari benda yang sama. Bangun tidur pergi kerja. So then I need to find something new. So then suddenly saya jumpa seorang kawan ni. Dia kata, jomlah lepak, ada satu tempat ni, pusat remaja, ada internet semua. Wow, interesting. So then saya pergilah. Dia ajak, okay, saya pergi. Oh, ni ada Cafe 18. So then bila ada masa lapang, saya pergi. So then I try to recognize what are this. So then baru saya tahu kesihatan reproduktif untuk remaja. Reproductive, susahnya nak sebut. Reproductive. So start daripada situ, saya cuba mengenali. Then bila saya ikut dia punya aktiviti, saya dah belajar apa yang dia ajar semua. So baru saya tahu ini sangat penting. Sebab kawan-kawan saya, bila saya berbincang dengan kawan saya tentang benda-benda macam ni, hari tu kawan saya cakap macam ni, tapi saya belajar macam ni pula. Mana satu yang betul?
Gap, ya?
So sebab tu macam it's good. So macam peer-to-peer education. Maksudnya young people to young people. So sebab kita hanya discuss dengan sebaya kita je.
Betul.
Kita tak discuss dengan parents. So kita akan dapat maklumat dari diorang. Kalau betul maklumat diorang, betul lah. Kalau salah.
Okay. Final question to Azrul. Moving on from here, what after this? Because we have started this, and I think it's a very good thing that this two exemplary members of the society are doing. So what next should we do to make to have that ripple effect, so that others will join on the bandwagon and do this? Yeah.
In your introduction just now, you spoke about the budget that's coming up, and you know, one of the things that needs to be realized is that we need to increase the investment that we're making on the critical decade, which is from 10 to 19 years old. Right now, this is what we call the adolescent phase. And when we look at it in terms of the sexual onset of sexual activity all the way up to getting married, in Malaysia, young people are getting married later. So the period in which they are sexually active is increasingly higher. And right now, what's happened here is that there is an opportunity here for us to be able to understand the problem, the scale of what we are trying to deal with, involve young people, you know, in the design and implementation of programs. We need to make sure that our policies and laws reflect the reality on the ground. You know, and basically what we need to do is to also address some of the issues that young people are facing. Sexual violence, gender disparity, teenage pregnancy, and to accept it that this is what we need to do. But most importantly, we need to recognize it's necessary to invest in these people.
Thank you so much, Azrul. Thank you so much, Firdaus. Thank you.
Can I add something?
Yes, sikit je.
Okay, sikit je. Okay, just like what Azrul said, young people are, most of them are sexually active. This is the reality. Thank you.
Okay, jadi macam kita kena cerdik lah. Terima kasih banyak. Kita berhenti rehat. Dan kita akan kembali lepas ni, kita akan cerita tentang penganggutan, apa sepatutnya harus ada dalam bajet 2012 ni, supaya kita, orang kata, nak pergi ke satu tempat tu bukan saja secara efisien, tetapi juga tak perlukan kos yang banyak. Itu kita bincang selepas ni. Thank you so much. Pleasure.